Well, thank you very much. First of all, it's a real honor to be invited to talk about a subject that's pretty important to me. I'm excited about the virtual care experience because it's becoming more important with the COVID crisis and things going on. But it's something that is such a benefit for patients, and we've really had such a positive response. It's something I'm always excited to talk about. So I appreciate y'all having me here for this. Um, Starting out, basically, virtual care has kind of been around for decades, just in a lesser format. We've been basically since the invention of the telephone, just about, there's been lots of medical visits that have been done over the phone between physicians and later nurse practitioners and PAs and their patients. And these have been very beneficial for patients for different reasons. And then what we've done now in the last few years has been able to add the video concept of that. And that video concept really does push it forward as far as physical exam features, which I'll talk about in a minute. But it's something that has a lot of benefits for the patient and even for patient families sometimes. Benefits like not having to come out in case if you're immunocompromised or you're having health issues of your own that you need to discuss with a physician or PA or nurse practitioner, but are unable to get to the physician office physically. It's just your conditions are so severe. And so we see a lot of that going on now. Things with hospice, nursing home. In the nursing home area, it's very important that the virtual visits are occurring because most of the nursing homes have certain very strict procedures of anyone coming into the facility. And that precludes a lot of times the physician being able to come in and visit with the patients physically. The nursing staff can then use a monitor or a laptop and be able to still attain that visit for the patient. So that's been very helpful in that regard. Other benefits are, of course, convenience. It makes it nice if you have a very hectic schedule. Parents of young children that are on the go doing things for them have been able to have visits through the virtual care at Hugh Chatham just over the telephone. They'll stop their car and say, oh, I need to talk about little Johnny here. He's got this issue, or Sally's got this. And most of the time we've been able to handle those kind of visits over the phone for them. And so it's been very positive and beneficial for the patients in the community that way. Of course, the big thing on the mind, as you listed, was COVID. That's a big concern out there. And so limiting exposure to other people right now is kind of the norm. We're social distancing and things like that. And this is where the virtual care platform has been very helpful. Patients that need even regular checkup visits with their primary care physician, our facility has several physicians that are able to do this through Zoom or other platforms. And my wife included, she is as a nurse practitioner in internal medicine with Hugh Chatham. And she's been able to have numerous visits with her patients through Zoom. Even in the middle of the day, they can schedule those appointments in between the other appointments. And she'll know that she's seeing this patient in the office and then she's seeing this patient by Zoom. She sees a lot of elderly patients that are unable to get out. So it's been very beneficial and able to keep those patients up to date, keep their medications refilled as needed, to find out about any changes in their health conditions that she can then address. So it's extremely beneficial for those reasons too, not just for acute care issues, which is what I see mostly through the express care and through our virtual care. I do mostly the on-demand visits, things that sort of come up spur of the moment. I'm suddenly sick and I need to talk to somebody about it. But also it's important, that we're able to have this available for people for their regular checkups and things like that. The other thing that I wanted to talk to you about was so a common question that comes up is, how do you perform a physical exam, over a laptop or over a telephone or anything like that? And it's a common question. It's a good question. It definitely is limited in that we can't palpate the patient. There are certain areas of the patient that we just can't see, but for the most part, we're able to do a very complete physical exam. If the patient has access at home for a blood pressure cuff or a way to measure their pulse, their oxygen sensors, several patients that have different chronic conditions will have these things available, and they'll be able to check it right there in front of us. And then the other aspects of the physical exam, of course, is sight. Primarily, even when you go to the doctor's office, the most of the visit, as far as physical exam component, is visual. That's what we're looking at things. We're looking at skin color. We're looking at your affect, how you feel. You can tell a lot just looking at a patient before he even says anything. And so for physical exam, you're getting a lot of physical exam over the phone. It's been interesting. Sometimes I'll have patients, or even sometimes patient's family, to hold a flashlight in a certain area, aim the phone a certain way. I've been able to look at throats, even looking in the ear canal. Can't really get a good look at the tympanic membrane yet, but we can look in the ear canal and see if there's foreign body, if it's a cerumen impaction, that's pretty obvious, things like that. All kinds of rashes and things, and some of them have been in kind of odd places. So I just want to assure everyone that these meetings are over a secure link in Zoom, so that it is still HIPAA sanctioned at this point, and so you can kind of be confident that these things are. I still try to encourage patients to yeah, just tell me more about it than to show me if it's in a private area or anything like that. But sometimes they're pretty aggressive. They want you to see it. Along with the physical exam, though, of course, is history, and that's where any medical visit, about probably 70% of what you're going to be deciding the patient's medical condition on is history. And so a good point that my wife brought up to me not long ago when we were discussing the virtual care visits is that with virtual care visits, the patient does get a benefit in that you have a provider that's really listening closely. We need to listen because we can't see as much, or we can't feel as much, of course, through the virtual care platform. So we're listening intently to what the patient's saying, and probably, more than when you're in a doctor's office visit, because we're relying so much on the history that you give. You'll be asked probably more questions during the visit and allowed more time to talk. The typical visit will last about 15 minutes, but it sometimes can last longer. I had one that I think went 40 minutes, but it was pretty involved, and the patient had a few different issues that were concerning to them. With the virtual care platform, something we've been working on since the inception of it with Hugh Chatham is making it easier for the patient to access, and for patient family to help them access if they're not able to. And the ways to access virtual care through Hugh Chatham, one easy way is to go to our website. And at the website, you can follow the link and go directly to the virtual care platform. There's actually a Hugh Chatham virtual care app now, and you can have this downloaded on your phone, or I think even laptop. I'm not sure about a desktop, but for sure on your telephone. And with this virtual care login, they're going to ask you some questions, as far as, of course, the reason for the call, and they're going to try to gather health insurance information, things like that. Once you've gone through those preliminaries, then you'll be connected to one of our virtual care clinicians. For the acute care side, there's 3 that are actively doing it now. It's myself, Jennifer King, and Kim Phillips. Actually, Parrott, excuse me, she used to be Phillips. And all 3 of us work in the acute care aspect at Express Care in Dobson, and both carry considerable experience. I've been at this going on 23 years now. Kim, probably about 7 years more than me, and Jennifer, in the acute care setting, I know at least 8 years. And so we bring a lot of experience available for on-demand visits, but we do encourage the patients that are with a practice in the Hugh Chatham system to discuss, if they need to, virtual care visits with their clinicians, because I think most of our clinicians are up to speed on this now, and most are already doing virtual care visits. It's just very helpful, and we're making the experience easier. For patients that have a real difficult time with the technology of logging on, which is not many these days, but if there are some, we have other ways of helping them. They're looking into being able to get home health nurses to be able to go into the home and actually kind of set the visit up and be there to help walk the patient through the visit and help the clinician with palpation and things like that. And so we're working very diligently to make sure this has an access to everyone. There's a cash pay price that's available. That's a slight reduction in the fee with a discount if you have to pay cash, but at least that way, hopefully we can get the people the care that they need when they need it. The whole experience as a whole, I have to say, has been very positive. I've not yet had a patient in probably, I guess, 4 or 5 months of doing this that has reacted negatively to having to do a visit over the telephone or over the laptop or desktop computer. Everyone has just been thrilled, I think. At least that's the response that I've got, and my colleagues as well that I've talked to, just thrilled to be able to have this available as a convenience or as a necessity for those that couldn't get out. I had one poor gentleman with such horrendous back pain, he was unable to get uh, into the vehicle to get there. And he said, I don't feel bad enough to call an ambulance, but he said, I just need to talk to someone about what I need to do next. And we were able to work with him, and actually within a week, he was back on his feet and doing well. And it was neat to be able to handle all that, including a follow-up visit over the virtual care experience. So it's been a great thing. I don't have a lot more to talk about with it. I can certainly answer a lot of questions.
And
If there's any questions, Laura?
hey, and I did want to add, I think that, you know, you talked about our providers that we have providing the virtual care. I think that's a really big differentiator because there are other platforms that are out there. But I think the beauty of this is, you know, for me, if I'm traveling and I have my family with me, or, you know, even if I'm at home and I need to use that with myself or husband or one of my children, it's providers that I know and I'm familiar with and have probably seen at some point in the urgent care or the express care setting. So, you know, you think if you go to the beach with your family and somebody gets sick, you can talk to Ashley or you can talk to Kim or you can talk to Jennifer, and you know them and you know Hugh Chatham, and you know those providers. So that's, I think, for us, a really big differentiator. So I just wanted to add that.
Have you found that what we're dealing with COVID obviously has elevated the use or the need for this type of service?
Absolutely. It's a great question. It's primarily, I think, where Hugh Chatham jumped into the virtual care area, because we quickly found that, you know, due to the quarantining and stuff, especially initially, that patients weren't coming to the doctor. And even though they were allowed to come to the doctor in the initial quarantine, that was one of the exceptions to the rule. People just weren't, and probably for good reasons. You know, they were wanting to stay safe for themselves or not spread anything they had to anyone else. But then we quickly realized that's a great limitation in access to care. And so this was a platform we were able to introduce and jump right on trying to get these visits done for people and they could be treated. But since you're right, since this COVID thing, it really has elevated, I think, in the use of virtual and telemedicine. I remember telemedicine as far back as maybe 6 or 7 years ago with specialists. And actually in the emergency room setting, I used to do primarily emergency room care. And during that time, we would have telemedicine for services that we didn't have at Hugh Chatham, that we had to sort of borrow from Winston-Salem practices. And one of them was for neurology. Before we had neurology in on call in Elkin, we were able to, you know, if we had a patient that we thought was having an active stroke or other very severe acute neurologic syndrome or symptom, we could actually